Public Service and Administration Minister Inkosi Mzamo Buthelezi has told the Government Employees Medical Scheme Symposium, currently underway in Cape Town, that the NHI is about addressing the root causes of the challenges facing South Africa's health system holistically. The minister also added that the NHI is about bridging the gap between public and the private healthcare system. For more on this, we cross to SABC News reporter Lulama Matya, who's standing by for us. A very good afternoon to you, Lulama. Tell us what's happening where you are.
Good afternoon, Nompu and the viewers. Welcome to Cape Town, where the GEMS Annual Symposium is currently underway. Yes, the Minister of Public Service and Administration, Inkosi Mzamo Buthelezi, officially opened the symposium. And in his opening address, he mentioned the importance of a universal health care. And also, Nompu, that is the topic under which the symposium is currently being held. They are looking at the universal coverage on healthcare issues. The minister was saying that those who are opposed to the NHI, it's because of a lack of knowledge, indicating that the bill which was signed into law by President Cyril Ramaphosa before the seventh administration, he's saying that some of the concerns that people were raising, even some of the political parties in parliament that were against the bill, he's saying that they were not against the universal health coverage, but they were saying that there are issues that needs to be addressed before the universal health coverage is rolled out, indicating that firstly, they wanted to make sure that the system has enough doctors, there are enough beds, hospitals are fully equipped in order to ensure that NHI is rolled effectively. He also mentioned, Nompu, that this NHI is about bridging the gap between the private and the public health care. We know that the private health care, which have massive resources, is catering for a smaller percentage of South Africa's population compared to the public sector, which is not well resourced, which, Nompu, we always hear people complaining that there's not enough nurses, there's not enough doctors, there are not enough beds, but that sector is catering for the massive population of this country. He's saying that the NHI is aimed at addressing those inequalities, making sure that every South African is afforded, is given an opportunity to get quality health care. And Nompu, if I can mention also that this symposium is starting today, ending tomorrow. We know that GEMS Medical Aid has beneficiaries of more than 2.3 million beneficiaries who are expecting those beneficiaries to hear from when the symposium ends tomorrow what resolutions have been taken here about rolling that universal health care. In the morning, Nompu, we spoke to the principal officer, Dr. Stanley Molwabi, who also said that as GEMS, they are not against NHI. That is some of those issues that they will be discussing here as to how, as the GEMS Medical Aid, will contribute, what will be their role in rolling out that universal health care. So we were hoping to be joined in this crossing, Nompu, by Dr. Vuyo Ngola, who is the Chief Operations Officer. But because the events are running, and you know when you are running a live event, you don't get what you want at exactly the same time that you want. She is presenting inside, so unfortunately she could not join us, but also her focus of presentation is about how to achieve that universal health care so that each and every South African is afforded quality health
Lulama, it's well understood. Thank you for that, and thank you for giving us a comprehensive roundup of what's taken place thus far. That's my colleague Lulama Matya reporting from Cape Town for us at that GEMS symposium taking place.